In the realm of healthcare, few topics ignite as much debate and discussion as the comparison between the French and American systems. At first glance, these two nations, both celebrated for their rich histories and cultural significance, diverge dramatically in how they approach healthcare, leading to vastly different experiences for their citizens. The French healthcare system, often lauded for its accessibility and efficiency, stands in stark contrast to the predominantly private, often fragmented healthcare system of the United States. This narrative will delve into the core differences in structure, cost, access, health outcomes, and public satisfaction, illuminating the unique features of France's universal healthcare model and the implications these have on patient experiences and overall health. At the heart of the French healthcare system is its commitment to universal coverage. Established in 1945, the system ensures that all citizens have access to a wide range of medical services, including preventive care, hospital stays, and specialized treatments, with minimal out-of-pocket expenses. This universal model is funded primarily through a combination of government taxation and mandatory social health insurance contributions, which allows for a comprehensive safety net that covers nearly 100% of the population. The French government plays a central role in regulating healthcare costs and maintaining standards, which helps to keep expenses manageable for both the state and individual patients. In stark contrast, the United States operates under a predominantly private healthcare system, characterized by a patchwork of insurance providers, employer-sponsored plans, and government programs such as Medicare and Medicaid. Despite spending more per capita on healthcare than any other nation, an astonishing figure that eclipses even the most affluent countries, the U.S. system leaves millions without adequate coverage. The complexities of insurance networks often result in high out-of-pocket costs, copays, and deductibles, creating a barrier to access for many individuals. This fragmentation leads to significant disparities in care, where the quality and availability of services can vary dramatically based on income, employment status, and geographic location. The implications of these structural differences are profound. In France, the ease of access to health services fosters a culture of preventive care, where regular checkups and early interventions are the norm rather than the exception. The French system encourages patients to seek medical advice without the fear of incurring crippling debt, leading to better health outcomes and a more proactive approach to health management. Chronic diseases, such as diabetes and hypertension, are often better managed in France due to the regular monitoring and comprehensive care that patients receive. The emphasis on preventive measures not only enhances individual health, but also reduces long-term costs for the system as a whole. Conversely, in the United States, the fear of high medical bills often deters individuals from seeking timely care, leading to delayed diagnoses and exacerbation of health issues. Patients may avoid routine screenings or necessary treatments, resulting in higher rates of complications and poorer health outcomes. The management of chronic diseases can be particularly challenging, as patients may face barriers to accessing the medications and regular follow-up care they need. This reactive approach to healthcare can create a cycle of worsening health and escalating costs, as untreated conditions lead to more severe complications that require expensive interventions. When evaluating health outcomes, the differences between the two systems become even more pronounced. Life expectancy serves as a critical indicator of a nation's healthcare effectiveness, and here, France consistently outperforms the United States. According to the World Bank, as of 2021, life expectancy in France was approximately 82.5 years, while in the United States, it lagged at around 78.5 years. This disparity can be attributed to several factors, including access to preventive care, the management of chronic diseases, and the overall health infrastructure. Additionally, France boasts lower rates of infant mortality and better maternal health outcomes, further underscoring the effectiveness of its universal healthcare model. Public satisfaction with healthcare also highlights the strengths and weaknesses of each system. In France, surveys consistently reveal high levels of satisfaction among citizens regarding their healthcare services. The ease of access, quality of care, and minimal out-of-pocket expenses contribute to a sense of security and well-being among the population. French citizens appreciate the ability to choose their healthcare providers and the assurance that they will receive necessary care without financial hardship. This satisfaction is reflected in the public's strong support for the universal healthcare system, which is viewed as a fundamental right. In contrast, satisfaction levels in the United States are often mixed. While many individuals express satisfaction with their specific health plans or providers, the overall sentiment regarding the healthcare system tends to be more critical. Concerns about high costs, insurance complexities, and gaps in coverage lead to frustration and anxiety for many Americans. The fear of medical debt looms large, with studies indicating that healthcare costs are a leading cause of personal bankruptcy. This dissatisfaction is further exacerbated by the ongoing debates surrounding healthcare reform and the struggle to achieve a more equitable system. As the world looks to France as a model for universal healthcare, several lessons emerge that the United States might consider in its quest for a more accessible and effective healthcare system. One of the most significant takeaways is the importance of preventive care and early intervention. By prioritizing preventive measures, the U.S. could potentially reduce the burden of chronic diseases and improve overall health outcomes. Implementing policies that encourage regular health screenings, vaccinations, and wellness programs could foster a culture of proactive health management, ultimately benefiting both individuals and the healthcare system as a whole. Moreover, the French model emphasizes the need for a streamlined approach to healthcare delivery. By reducing administrative complexities and ensuring that all citizens have access to a comprehensive range of services, the U.S. could enhance patient experiences and improve health outcomes, simplifying insurance processes, expanding coverage options, and ensuring that all individuals have access to essential health services, regardless of income or employment status, could pave the way for a more equitable system. However, the adaptability of the French model to the uniquely complex landscape of the United States raises important questions. The U.S. is marked by significant diversity in terms of geography, culture, and socioeconomic status, making a one-size-fits-all approach challenging. Implementing a universal healthcare system would require careful consideration of regional variations and the diverse needs of the population. Additionally, the entrenched interests of private insurance companies and the political landscape surrounding healthcare reform complicate the potential for adopting a model akin to France's. As discussions around healthcare reform continue, it is essential to engage in open dialogue about the strengths and weaknesses of both systems. What aspects of the French healthcare model could be effectively integrated into the American context? How can the U.S. address the systemic barriers that prevent access to quality care for all individuals? These questions invite readers to reflect on the complexities of healthcare delivery and the potential paths forward. In conclusion, the comparison between the French and American healthcare systems reveals a stark contrast in structure, cost, access, health outcomes, and public satisfaction. France's commitment to universal coverage and preventive care stands in sharp relief against the backdrop of the U.S. system, which grapples with high costs, gaps in coverage, and significant disparities in access to care. The implications of these differences are profound, shaping patient experiences and influencing overall health outcomes. As the United States navigates the complexities of healthcare reform, the lessons drawn from France's approach may serve as a guiding light, illuminating pathways toward a more equitable and effective healthcare system for all. The conversation surrounding healthcare is far from over, and the exploration of these vital topics will continue to evolve as society seeks to ensure access to quality care for every individual, regardless of their circumstances.